Today we're going to be talking about one of the most common injuries to the shoulder that we see in the office, and that is the rotator cuff. R for rotator cuff. When talking about the rotator cuff, we first have to talk about what muscles make up the rotator cuff. There are four muscles together, as you can see on this page, that make up the rotator cuff muscles. Rotator cuff means that there is a cuff of muscles around the shoulder that helps with rotation of the shoulder. So we can look at the four muscles. The first one, the supraspinatus muscle. Right here you can see it's positioned on top of the shoulder blade. We have the infraspinatus muscle, which is below the spine of the shoulder blade. We have the teres minor muscle here, which is also below the spine, kind of right below the infraspinatus muscle. And then we have the subscapularis muscle, which is actually on the front of the shoulder blade. So this picture, we're looking at a frontal view, whereas all three of these pictures here we're looking at the back view. Next, we want to look at the causes of pain. So there are three typical most common causes of rotator cuff pain, and that can either be in the form of a tear, tendinitis, or tendinosis. So the tendinitis and the tendinosis can actually lead to a tear within the tendon itself, or we can have an actual tear within the muscle belly of each of those four muscles. So all three of these can be very painful and cause dysfunction within the shoulder. The difference between tendinitis and tendinosis is that tendinitis is usually more of an acute injury, whereas tendinosis is more of a chronic injury. Tendinitis is an irritation and inflammation of the tendon, resulting in tiny micro tears that can cause pain, achiness, and swelling, whereas tendinosis is more of a deterioration of the tendon with the collagen proteins and breaking down the fibers. So it's more of a chronic condition. Tendinitis can lead to tendinosis if not treated. The cause of the tendinitis and tendinosis type injuries, tendinitis is more of a injury from an overload of the tendon's tensile strength and can happen over time and repetitively, whereas the tendinosis is typically long-term overuse and repetitive stress on the tendon itself and doesn't allow the body to heal over time. Treatments for tears, tendinitis, as well as tendinosis typically include, first and foremost, reducing inflammation and pain. So we want to get the inflammation and pain out of the way so that the body can start healing a little bit better. And then doing things like mobilizations to the muscles, restoring mobility if there's lack of motion within the tendon or muscle itself, strengthening and stretching exercises, rehab exercises, tissue mobilizations and massage. And laser therapy is also a common one that we'll use, which actually helps speed up the healing process. And if there are damaged tissues, whether it's tiny micro tears from the tear or tendinitis, or if there's degeneration within the tendon or muscle itself, the laser therapy will help to speed up the healing process and kickstart the regeneration process of the muscle tissue as well as the tendons.